I'm one of several attorneys here at Shane and Gordon who practice in the Vaccine Injury Compensation Program. My name is Heather Menezes. I'm admitted to the Court of Federal Claims, which is where the program is run. Vaccines, of course, are public health necessity. So there are the rare instances where there's injuries, and that's what the Vaccine Injury Compensation Program is designed to do. But definitely, yes, vaccines are a necessity. So the Vaccine Injury Compensation Program was started in the 1980s when there was a threat of vaccine manufacturers not producing vaccines. And so now there's a 75-cent excise tax on every vaccine that goes into a fund. If someone is injured by a vaccine, again, it's rare, but it can happen. There's a fund available, and there's a government program available to provide compensation for people who are injured by a vaccine. So right now, the COVID-19 vaccine, any of them, are not covered under the general Vaccine Injury Compensation Program. It's part of a separate fund called the Countermeasures Injury Compensation Program, or the CICP. What's considered a countermeasure is anything that is used to combat the pandemic. So certainly that's vaccines, but it's other things as well, including mechanical ventilators, medications that are used to treat COVID-19. Those all fit under the umbrella of countermeasures that's under the Countermeasures Injury Compensation Program. There are a lot of differences between the VICP, the Vaccine Injury Compensation Program, and the Countermeasures Fund, which the COVID-19 vaccine is currently in. The big one is that there's a 1-year statute of limitations from the date of the vaccination for the COVID-19 vaccine. So that's tough. Some people don't know of the connection between their injury and the vaccine immediately. And another big one is there's no pain and suffering damages in the Countermeasures Fund. So the fact that we have a number of COVID vaccines approved now is really good. But one of the things, and certainly that's publicized, and one of the things that hasn't been publicized, though, is that these vaccines, if there is an injury, and again, I'm going to stress, it seems like it's a very safe vaccine. But if there is an injury, then those injuries have to go through the Countermeasure Injury Compensation Program. And the biggest part of that is that there's a 1-year statute of limitations from the date of the vaccine or any countermeasure, whatever that happens to be, which can be difficult. So if on, a year and a day, if you try to seek compensation from this program, you'll be denied. So if people don't know about the program, then you can't try to seek compensation from it. So it's important that people know it exists. Under the Vaccine Injury Compensation Program, you can go through the program and then at the end decide to reject any judgment or award, and you can then go and sue the vaccine manufacturer or another party that's involved with your vaccine injury. You can't do that with the Countermeasures Fund. All manufacturers are immune from liability, period. We're in a pandemic, and there's a lot of risks involved, but there's a lot of risks involved for the people taking the vaccine as well. And from what I've heard about the current COVID approved, FDA approved COVID vaccines, they're safe, they are effective, but there's a lot we don't know. And it's just not fair that if there were to be an injury, there's very limited resources available for somebody. I think it should be in the regular Vaccine Injury Compensation Program for those rare instances where there's a serious injury. The covered vaccines under the Vaccine Injury Compensation Program, there's actually a table, and if you Google it, you can find out if the vaccine that you've gotten or you have an injury from a vaccine is covered under the program. But generally, it's vaccines that are approved for routine use in children. But that also includes if you're an adult and you get a vaccine, then if that vaccine itself is part of the program, you're still covered under the program as an adult. So a big one is the flu vaccine. So it's approved for use in children. Adults take it too. If an adult is injured by the flu vaccine, then that adult can seek compensation under the Vaccine Injury Compensation Program. Whatever decision you do, it's a like risk benefit analysis, right? Like, do I go see so-and-so? Well, all right. Do they work from home? Blah, blah, blah. So with getting the vaccine, it's basically the same thing, the COVID-19 vaccine. It's a risk benefit analysis. By all accounts, from what is being reported, it's safe. And the benefit is we're done with the pandemic. So I don't think there's anyone that wants to keep going with this. But if there's an injury, which could happen, then there should be something available for someone who is injured by the vaccine. I would hope it would be under the Vaccine Injury Compensation Program, but right now all we have is the countermeasure program.